All right. Thanks for coming in, Rob. I really appreciate it.
Absolutely.
We're going to be talking about ketamine here at CWI and what your experience has been with that and also your medications. So just start wherever you want to and with whatever you would like to share, and then tell us what's been going on.
Okay. Well, I started here at CWI a little over a year ago.
Mm-hmm.
And my first contact was with psychiatric nurse practitioner Margaret Johnson.
Mm-hmm.
And I initially contacted the clinic because I was interested in pursuing ketamine therapy for a variety of issues that I had been having.
Mm-hmm.
They ranged from severe depression, anxiety, to a complex post-traumatic stress syndrome disorder diagnosis. And Margaret and I met, and we talked for a while, and then we scheduled another appointment, and I began the ketamine-assisted psychotherapy.
Okay. What's it been like for you?
It has been transformational. Before I began ketamine, I was sleeping 16 hours a day, acting out in acts of self-harm, things like this. And my mental life was just like I was on a treadmill of constant worry, depression, and then anxiety. It took a little while for the ketamine to have an immediate impact, but about 2 or 3 sessions in, it really started to influence the way I was thinking, which influenced my behavior. And the insights that I was able to gain during the ketamine treatments were invaluable. Furthermore, the treatments themselves are a positive experience. And I feel that the ketamine therapy has really turned my life around to the point where instead of once a week or once every 2 weeks, I'm able to come into the clinic maybe once a month and do more maintenance journeys with Margaret to maintain the ground that I've gained and to continue to gain ground.
That's outstanding. Rob, I want to thank you for being in here, and Margaret and I are going to swap places because she's right outside of the camera view, and I want her to talk with you about what she has seen with your ketamine treatment. And I do have one question for you.
Sure.
We've adjusted some of your medications since you've been here.
Yes, we have.
Okay. How has that been for you?
The medication adjustment has been a switch from what I would describe throwing pharmaceuticals at my issues,
right,
to a whole systems health approach that has looked at my metabolism, my hormones, as well as the more common antidepressant type medications. I'm taking fewer medications. I'm having a lot fewer side effects.
Outstanding. All right. Thanks for getting that in. And now I'm just going to swap places with Margaret.
Okay.
So,
Hi, Rob.
Hi, Margaret.
So great to see you.
Good to see you.
So we met about a year ago, is that right? And would you remind me, had you had ketamine treatment in the past?
Yes, I had. I had received intravenous ketamine therapy for approximately 6 months. And that was a unique experience. It did impact my depression. So I knew that ketamine as a theory worked. I had done some independent research and read a little bit, but what I found out when I came to Cady Wellness Institute from you is that through intramuscular ketamine injection, it allows us to target the problem areas in a more direct way instead of just washing my brain in a chemical for an hour and oftentimes losing consciousness because it is an anesthetic.
Right, absolutely.
And in those experiences, I didn't feel like I've had the complete transformation that I have with your
Right.
treatments.
Because we know ketamine helps people.
Yes.
What do you think sets it apart? Do you think, I've talked about preparation before treatment, set and setting. Can you speak to that some? Because you've done remarkable work with intention setting.
Absolutely. The process of the ketamine therapy that I receive here is to do preparation.
Right.
To come into the treatment session with a clear intention of what you're seeking from that session.
Right.
And so the mantra that I've kind of developed is setting intention.
Right.
And the intention, I think, is the most important part of those three, but the set, the environment, the drug itself. You don't use other medications along with the ketamine.
Right.
And that is key because in IV ketamine, you can receive ketamine along with other chemicals and drugs to help with other problems, chronic pain, etc. But in the IM or intramuscular sessions, it's, like I said, a more targeted approach.
Right.
So setting, coming to a relaxing environment and being allowed to experience low light stimulation, even using an eye mask, if you're comfortable doing that, helps block out other distractions. And then again, the intention. What I do personally is I incorporate my spirituality.
Correct. And we know that in the world and the community that works with ketamine or other things that are coming in the pipeline, spirituality is a large part of healing.
Absolutely.
And you have beautifully utilized that in my experience with you.
And I had a spiritual upbringing, but it has really flourished and even grown deeper through my ketamine experiences. It goes beyond the organized religion aspect and cuts to the true universal spirit that we all as humans have. So setting an intention, and then the other key, integration.
Right.
Integration.
Right.
You've been kind enough from day one to provide me with worksheets that I can take advantage of and take the opportunity to fill out the day after, usually, my experience. And it has open-ended, thought-provoking questions that encouraged me to go deeper into the experience and things that I learned, and then to carry that knowledge that has been gained into my daily life.
Right.
And that lasts throughout my visits.
Because when you say, at least in my experience as well, as we are fundamentally changing the circuitry, but it's even beyond that with our comprehension, with that setting intention, and then that integration can't be understated. So we all have to do the work with the ketamine.
Yes.
And so we hold the space for the work to be done.
Yes, holding the space. It is a lot more involved than sitting there and receiving 2 injections.
Right. I just thank you with all the gratitude in my heart for sharing your journey with us and allowing us to be part of your healing journey. It is truly miraculous to bear witness, because really that's my role, is to bear witness to your healing. You are doing the work with the medicine and your journey and your spirituality. So thank you so much for allowing me to be part of your journey.